1 in 8 American women will be diagnosed with breast cancer during their lifetime. Over the past 20 years, there has been an explosion of knowledge in our understanding of the biology of the disease, and this has resulted in tremendous improvements in treatment. 20 years ago, mastectomy, where the entire breast was removed, was the norm. Now we know that most women with early-stage breast cancer can be treated with breast-conserving surgery simply by removing the tumor with a small area of surrounding healthy tissue. And also, there have been some significant advances in terms of radiation treatment.
One exciting development is intraoperative radiotherapy. And this is exciting because we can typically treat patients who are candidates for this in one sitting. We go to the operating room, and when the surgeon takes the tumor out, we give 1 dose of radiation right there before the patient wakes up, and if the patient is a candidate for that, that's all they need. Also, there's something called external beam radiation therapy, and this technique is where we give a very focused dose of radiation that conforms to the shape of the tumor, and that means there's less collateral tissue damage from the radiation, which correlates to improved appearance and less side effects. Also, there are techniques that we use to avoid the heart. One such technique is called respiratory gating, where we will actually take a 4D CAT scan of the patient as she is breathing. Well, we can design the radiation beam to treat the left-sided breast when the breast has risen up above, away from the heart.
In terms of chemotherapy drugs, there have been some significant advances. We have drugs that specifically attack a special protein which is present in about 20% of breast cancers. They're much less toxic and less likely to cause side effects.
It's a very exciting time now to treat a breast cancer compared to 10 years ago. And the reason is we can do more testing based on molecular levels. Now we can decide the gene of the tumor, the mutation of the tumor, and based on that, design an individual treatment plan for this patient.
For women diagnosed with breast cancer, there are a variety of different side effects that she might experience depending upon the treatment that she's recommended. Some common side effects might include pain after surgery, or nausea, fatigue, hot flashes, and joint pain. So it's important to have a team of experts that could come together and work to help a patient in order to improve quality of life and manage those side effects.
It's particularly important that women newly diagnosed with breast cancer are aware of all of the many options and major advances in treatment that weren't available before. The fact is that treatment today is so different from where it was 20 years ago. The prognosis for many patients is so much better than it ever used to be.